Welcome to This Explainer. We're going to dive right in today. We are looking really closely at the evidence behind the massive hype surrounding GLP-1 medications, and we're answering the ultimate question: are they actually the key to a longer life? Now, this explainer and its slides were prepared by Dr. Thomas Hocker. He's a Harvard and Mayo Clinic-trained, triple board-certified dermatologist, Mohs surgeon, and dermatopathologist. What we're covering today reflects his opinions and expertise, and it was medically reviewed for up-to-date accuracy on July 6, 2026. Oh, and please note, this explainer is just for general education, right? It's not personal medical advice, and it doesn't create a doctor-patient relationship. You should always consult your own clinician for your individual care, and of course, seek urgent care for any urgent symptoms. Okay, so here's our roadmap. We're going to cut through the internet rumors with a highly structured, step-by-step decision framework. We've got the short answer, the weight loss hierarchy, disease risk versus immortality, side effects and Ozempic face, fact versus fiction, and finally, the action checklist. All right, section 1, the short answer, fixing health versus buying years. Let's respect your time and just set the record straight right from the jump. So the core hook here is that the new health fantasy, well, it isn't just about losing weight anymore. It's really about fixing your health, lowering inflammation, looking younger, and somehow actually buying more years of life. And honestly, that is exactly why these drugs feel so vastly different from your normal diet culture. But here is the crucial takeaway. These GLP-1 and GLP-1/GIP drugs, they are absolutely the most effective weight loss medications ever studied, hands down. And they have proven benefits for the heart, the kidneys, and the liver in the right patients. But, and this is a big but, they require a long-term commitment. They aren't some magical cure for aging, and absolutely no medication has been proven to make already healthy people live forever. Moving right along to section 2, the weight loss hierarchy, specifically the 3 generations of these drugs. Let's look at the data and visually map these out so we can understand how their mechanisms actually differ. Notice the really clear progression here. The first generation is semaglutide, which targets just one hormone receptor. That gives you an average of about 15% weight loss. Then we step up to tirzepatide, which targets 2 receptors. That produces around 20% weight loss, and it actually beats semaglutide in head-to-head trials. But finally, we've got a massive third contender on the horizon showing an unbelievable 24% weight loss. However, we have got to highlight a vital detail about that third contender, retatrutide. While that 24% number is incredibly striking, it is strictly investigational right now. It completely lacks long-term outcome data and is not FDA approved. And look, this isn't a reason to go out and buy research chemicals online. It's a reason to respect the massive difference between an experimental trial drug and a closely monitored prescription medicine. Okay, section 3, disease risk versus immortality. Let's see how this all builds. Because this is where the longevity conversation actually gets real, concrete evidence behind it. This really illustrates what these drugs do far beyond just changing the number on the scale. In high-risk populations, semaglutide reduced the risk of heart attacks and strokes by 20%. It slowed the decline of kidney function. It actually helped resolve fatty liver disease, which is also known as MASH. Tirzepatide, that's proven to reduce the severity of obstructive sleep apnea by roughly 50%. Plus, both of them are incredibly effective at preventing the progression to full-blown diabetes, all while modestly improving blood pressure and cholesterol. So they're actually treating the very diseases that steal years from your life. But we have to contrast those very real proven organ benefits against some of the wild internet hype, specifically surrounding Alzheimer's disease. Now, observational data did suggest lower dementia risks among users, and yeah, that looked very promising. However, the major, rigorous clinical trials for actually treating early cognitive decline with these drugs, they were completely negative. So please do not take a GLP-1 drug specifically to prevent or treat Alzheimer's based on the current evidence. All right, section 4, side effects and Ozempic face. Because human biology is so powerful, the trade-offs and the side effects of these medications are very, very real. As a skin surgeon, Dr. Hocker frequently sees patients who are super concerned about Ozempic face. So what is that exactly? Well, when you experience rapid weight loss, there's a deflation of the superficial fat pads in your face. That rapid volume loss leads to a hollowed, sort of aged appearance and loose skin. It's generally not some unique poisonous effect on the skin itself. It's just a structural change from losing that facial fat so quickly. And beyond the aesthetics, there are major medical warnings you've got to consider. Common issues are nausea and GI problems, sure, but there is also a 37% increased risk of gallbladder disease.
You can also experience meaningful muscle and bone loss if you aren't proactive about it. And then there's the harsh reality of maintenance. About 2/3 of the lost weight comes right back within a year if you stop the drug. So for many, these are chronic therapies, not just a quick seasonal cleanse.
Section 5. Fact versus fiction. Let's move into a rapid-fire sequence to debunk some of the most prominent and frankly dangerous myths circulating online right now. First up is the myth that retatrutide is basically bariatric surgery in a shot. The fact? Bariatric surgery produces sustained weight loss with literally decades of safety and outcome data backing it up. Retatrutide is investigational and currently has zero long-term safety data, so calling it a replacement for surgery right now is just dangerously premature. Here is another absolutely critical one. The myth that compounded versions from online pharmacies are a safe, cheaper alternative to the name brands. The fact, the FDA has warned about terrifying dosing errors. We're talking some patients getting up to 20 times the intended dose, along with really dangerous impurities. In fact, studies show compounded GLP-1 drugs have 2.4 times higher odds of hospitalization compared to the FDA-approved products. That is huge. And finally, the biggest myth of all, that these are proven longevity drugs for healthy people. The fact is, there is no proof these extend the lifespan of an already healthy human. They buy you years by reducing actual measurable disease risks, like heart attacks and kidney decline, in patients who are overweight or metabolically sick. Which brings us to Section 6, the final action checklist. The most important takeaway today is how you practically and safely apply this information. So here's a highly screenshot-friendly checklist to help guide you. If you're going to use these medications, you absolutely must do resistance training at least 2 days a week, and you have to maintain a high-protein intake to preserve your muscle mass. Also, plan early with the dermatologist for collagen stimulation to address any potential facial volume loss before it gets severe. And most importantly, you have to do all of this under a qualified doctor's careful supervision. To wrap this all up, this isn't some immortality shot for the already healthy. But if obesity, heart disease, sleep apnea, or diabetes is actively stealing your years, well, this might be exactly the tool you need to treat it. Consult your clinician and take that next safe step for your health. So I'll leave you with this. Are you just chasing a number on a scale, or are you actually ready to fight for the years of your life? Thank you so much for joining me for this explainer.